Everyone, and welcome back to my YouTube channel. So today is another healthy topics. So today I'll be discussing a very important health topic: high blood pressure, or you can call it BP. This is a topic that affects many of us. As someone who is passionate about health and wellness, I have seen what the impact of high blood pressure can do to our lives. And in this video, I'll be covering some key points of what you need to know or need to do regarding high blood pressure. So by what high blood pressure is, how to take action when you have high blood pressure. So stay tuned and watch. Pressure, also known as hypertension, is a medical condition where the blood pressure in the arteries is consistently high. And there are a whole lot of risk factors that can cause it, or there are a lot of things that can cause one to have high blood pressure. So for the risk factors, I'll be listing some risk factors that can cause high blood pressure. Family history, because according to study, blood pressure rises with age. Then we can talk about obesity in the sense that the person is overweight. When someone is obese, this can increase the risk of high blood pressure or having high blood pressure. Also, physical activities, when the person is not exercise friendly, he doesn't engage in any type of physical activities. We have like sodium intake. When someone consumes a whole lot of sodium, we have like alcohol. When there's too much of alcohol in your system, or you drink too much of alcohol. We also have like stress can cause it. Smoking, too much of smoking can cause one having hypertension or high blood pressure. We also have sleep apnea, and it's a lot of dizziness. You have fatigue, you have nose bleeding, you have convulsion. And when you notice all of these things and nothing is done, it can cause you a whole lot of complications, in the sense that the person might have a heart attack, the person can have stroke, the person can have vision loss, kidney disease, the person can have what we call peripheral artery disease. Blood pressure, there's a normal number for your blood pressure. There's elevated blood pressure. We have stage 1 hypertension, we have stage 2 hypertension. So for normal blood pressure is when your blood pressure is lower than 120/80 mmHg. mmHg, which means millimeter of mercury. Then we have elevated blood pressure when your blood pressure is over or ranges from 120 to 129/80 or higher mmHg. Now for the stage 1 hypertension is when your high blood pressure ranges from 130 to 139/80 to 89 mmHg. For the stage 2 hypertension is when your high blood pressure ranges from 140 mmHg to 149/90 mmHg. But actually, the elevated high blood pressure is not an actual health condition like hypertension, but elevated high blood pressure can worsen over the time if it's not properly taken care of. And that's why it's good to go for regular checkup, or you can have the machine in your house to always check your high blood pressure. And when it comes to for the elevated high blood pressure, when it's not properly taken care of, it can lead to heart attack, it can lead to stroke, it can also lead to memory loss, language deficit. Anything can cause elevated high blood pressure, which is higher than the normal high blood pressure, and which is not hypertension. Cholesterol, like a bit of fat, when someone has a whole lot of fat inside their body, this can cause elevated high blood pressure. Heart problem, when the heart is affecting the blood vessels. We have illegal drugs, when someone is taking illegal drugs or any hard drugs that is not actually good to the health. Some medications, maybe someone is taking a birth control pills. Sometimes cold medicine that we take, overuse of caffeine, smoking, too much of alcohol. I've said those things before. Or this can cause elevated high blood pressure. thyroid diseases. So whenever you're going for a medical checkup or you're going to meet your healthcare provider, make sure you tell them all the substance that you take, so that they will know the causes or what caused the high blood pressure, or for you to have a high blood pressure, or maybe it's no longer elevated high blood pressure, maybe it has migrated to stage 1 hypertension or stage 2 hypertension. But there are some ways that which you can help, which you can prevent hypertensions. No one can stop high blood pressure. High blood pressure will always be there, but there are ways which you can prevent it from rising. You can engage in regular exercise like walking, jogging, yoga, swimming. At least try to do some exercise for like 30 minutes every day. Eating healthy, you have to change the way you eat. Before, you have to eat healthy, eat more of veggies and green leaves. Focus on balanced diet to reduce the intake of sodium, saturated fat to reduce it, and cholesterol, you have to reduce it as well. Now you have to aim at maintaining a healthy weight. When you are overweight or obese, you need to look for a way to maintain a healthy weight. Also, getting enough sleep, like at least sleeping for 7 to 8 hours every day. This can help you to reduce high blood pressure, because when someone is stressed, sometimes really don't get enough sleep, maybe can sleep for 4 hours, 5 hours. These are risk factors. These are things that causes one to have a high blood pressure. But when you actually have enough sleep for like 7 to 8 hours at least, or 6 to 7 hours, this will help to reduce the risk of having a high blood pressure. Then you need to learn how to manage stress. Most times we are stressed from daily activities, we are stressed from what is happening. So we all need to know how to manage stress, because when you are stressed, definitely your heartbeat, everything keep racing. So we need to know how to manage stress to the barest minimum. Reduce your intake of alcohol, reduce your intake of smoking. If you cannot stop smoking, reduce smoking to the barest minimum. If you cannot stop taking alcohol, reduce intake of alcohol to the barest minimum. All this will help to prevent you having elevated high blood pressure and migrating to hypertension, stage 1 and stage 2 of hypertension. So when it comes to checking of your high blood pressure, you don't necessarily need to go to the hospital to check your high blood pressure. If you want to go to hospital, it's fine, but you can check your BP from the comfort of your home. We have a whole lot of machines which you can use to check your high blood pressure at home. We have the manual high blood pressure machine monitor. We have the digital one. We have the one you can put on your finger. We have the one you can put on your wrist. A lot of ways that you can check your high blood pressure. So please, let us always remember to take our health serious, because they said that health is wealth. And when it comes to your health, when you are unsure about the symptoms, always visit your healthcare provider. Don't go and buy medication on yourself without you knowing what is actually wrong with you. So let's be careful and be mindful of our health. Let's take care of our health. Let's go for regular checkup if need be. Let's prioritize our well-being, our health, which is very, very important. So thank you guys for staying with me, and see you next Thursday when I will be bringing another interesting topic about our health to us. Please don't forget to like, share, and subscribe. Thank you.